Dr. Abiola, who was talking about do we give steroids or not? We are coming there. Okay, again. So, management of infectious mononucleosis. How am I going to manage a patient with infectious mononucleosis? Number one, supportive therapy, supportive therapy, supportive therapy. What we say supportive therapy, what do we mean? Acetaminophen or NSAID, the patient has fever, sore throat, and malaise. Okay. Number two, you want to encourage water. You want to encourage adequate fluids. You want to encourage adequate nutrition. You want to encourage adequate rest. Now, the literature says not bed rest per se, but the patient should slow down a little bit. They should slow down a little bit. They should not keep going like the way Dr. Bruni goes all the time, right? So they should get, some adequate rest as well. Now, this is the question. Should steroids be used or not in infectious mononucleosis? Now, this is the teaching. Steroids not recommended, or steroids are not recommended therapy for routine. I'll come to when do we use steroids. Routine cases of infectious mononucleosis. Routine cases of infectious mononucleosis don't give steroids. Like, the patient is not looking so sick. So the question is, when do we give steroids in infectious mononucleosis? 3 situations. Please write it down. Number 1, the patient has airway obstruction. Number 2, if the patient has fulminant liver failure. Number 3, if the patient has severe hemolytic or aplastic anemia. What are the indications for steroids in infectious mononucleosis? Is it everybody we give steroids to? No. So who are these unique people? Number 1, if a patient presents with airway obstruction. Number 2, if a patient presents with fulminant liver failure, elevated liver enzymes, jaundice, the patient has developed, flapping tremors, they are disoriented because they may be developing some hepatic encephalopathy. Because don't forget that infectious mononucleosis can lead to hepatitis. Doctors, are you following me? And then if the patient has infectious mononucleosis with severe hemolytic or aplastic anemia, then I'm going to give my steroids. Dr. Abiola, now have I answered your question? Now, how do I pick up a patient who has airway obstruction? If I'm told that the patient has fever, sore throat, lymphadenopathy, and has difficulty breathing, and they get, this if they're in the recumbent position, then I'm thinking about airway obstruction. Those people, they need steroids. And as soon as I give them steroids, what's my next best thing? I'm going to get onto the phone and call a specialist right away. So, do we give steroids to everybody? No. But who needs steroids? Airway obstruction, fulminant liver disease, severe hemolytic or aplastic anemia. All right? How will a patient with airway obstruction present? Difficulty breathing, dyspnea in recumbent position. Now, even though infectious mononucleosis is caused by a virus, there's no need to give antivirals to the patients with infectious mononucleosis. No need. There's no need. It's not necessary to do it. There's no need. All right? Okay. So now, let's talk about return to sports. Return to sports. Can somebody tell me, can patients with splenomegaly in infectious mononucleosis, can their spleen rupture spontaneously or not?
Yes.
So now, when can the patient return to sporting activities? Number 1, when does spontaneous splenic rupture occur? Usually between 2 to 21 days after the onset of clinical symptoms, right? 2 to 21 days. Now, when to return to sports? Non-contact sports. You have to know the difference between non-contact sports and contact sports. Non-contact sports, they can return to non-contact sports 3 weeks from onset of symptoms. But contact sports like soccer, American football, basketball, lacrosse, those ones, boxing, minimum of 4 weeks. Non-contact spores, they can start 3 weeks from the symptom onset. Strenuous contact spores, minimum of 4 weeks. So 3 and 4, non-contact 3. Strenuous contact spores, minimum of 4 weeks. Doctors, please, is it clear? Non-contact spores, start 3 weeks from symptom onset, like something like ping pong or table tennis, golf. You're not hitting anyone. But football, lacrosse, basketball, boxing, no, minimum of 4 weeks. What about if I ask you, somebody developed infectious mononucleosis, when can they return to work? Or when can they return to school? There should be no restrictions regarding when they can return to work or school. So far the patient is feeling better, they can go back to school. They can go back to work as well. Because we learned that infectious mononucleosis is spread by intimate contact. So what are the complications of infectious mononucleosis? We are wrapping things up. We've learned when to give steroids. We learned that we don't give steroids to everybody. We are learning when to give steroids. What are the complications? Splenic rupture. We learned that the splenic rupture can be spontaneous. When does splenic rupture usually occur? Between 2 to 21 days after onset of symptoms. What are other complications of infectious mononucleosis? Airway obstruction. And with airway obstruction, I'm going to give what am I going to give? In airway obstruction, what am I going to give, please? What am I going to give? Airway obstruction. Steroids. And then what will I do again? What will I do again? I'm going to call.
Call the
specialist. And then another complication of infectious mononucleosis is prolonged fatigue. Now, fatigue with infectious mononucleosis and cytomegalovirus, which of these two has more fatigue? Can somebody tell me?
Infectious mononucleosis.
Splenomegaly in infectious mononucleosis and strep throat. Which one has almost no splenomegaly?
Strep throat.
Infectious mononucleosis and strep throat. Which of them has less fatigue?
Strep
throat. Good. What are the differential diagnoses of infectious mononucleosis? HIV,
cytomegalovirus,
toxoplasmosis, HHV types, yeah.
6 and 7.
6 and 7.
What are conditions which can give me positive monospot tests?
WBC is gonna be high.
No, what conditions? We learned about lymphoma, pancreatic cancer. Remember those ones?
Yes.
Now, what are the indications for giving steroids in a patient with infectious mononucleosis?
Airway obstructions, liver elevated,
severe hemolytic anemia.
And what else?
severe
Aplastic anemia, right? Good. Fever plus lymphadenopathy plus pharyngitis. You've got to do a diagnostic evaluation for streptococcal infection by culture or antigen testing. And what are some rare complications? There can be peritonsillar abscess and airway occlusion. Okay.